fat pad which is coming down. There is no definition to the mandibular angle, right? So this is what we are trying to reposition. The best point with thread is you are just repositioning the normal fat only into the original position. So what is the signs of aging and what is the sign of being youthful? You preserve your right. Everything sags down when you start aging. The angle of corner of the eye sags down, the fat melts down, creates a jowl and double chin. The angle of the mouth sags down. This is the sign of aging. So this is what you see. Though she does not have much of sagging over the corner of the angle, but of course the fat is melting. The beauty of hers is creating now the sign of aging. So she has jowl, she has double chin, she has lost the definition to the mandible. This is what we are repositioning. I would like to correct one thing. People were saying that you cannot give volume with threads. If you are going very superficial, like superficial fat pad, then it will give just the lifting effect. But if you are going deep subcutaneous tissue, this will reposition the. So are you creating the volume? Are you thinning down the face? Yes, you are. So you can create. It's the technique you are using. If you are going superficial, it will give you the tightening. If there is a young patient, you just need to repositioning the youthful appearance. Just go little superficial. But if you are handling a client like hers or me at my age, then you'll go little deeper to pull back the anchor entire fat over the original position. Right? Now, where do we incorporate our threads? So dermal threads are floating type. Okay, absorbable, non-absorbable. There is no question because in India we don't have non-absorbable sutures. So whatever we are doing is absorbable sutures, which is going to get absorbed in a time duration of 6 months to a year. If you are doing COG, it will last 1 year. The thread we are doing today, PCL, will last 1.5 years also. Okay, so the dermal threads, the mono thread, those are very fine threads which comes in the needle incorporated, where I'll give you hands on to all of you. That is why it is floating, because there is no anchoring point. What is anchoring point? So actually you anchor. जब हम नाव को बांधते हैं, तो we have one anchor where you tie your boat, right? So that should be very stiff, that should be hard, that should be strong pillar to give strength to your threads, right? So those are our fascias and the ligaments. So here for the midface we use the zygomatic retaining ligament, which is over the zygoma. So there we anchor our thread, so it gives support. The ligament is very tough structure. You incorporate your threads into that, so it doesn't move from here. So that is how it lifts. That is how it gives you a vector of force, right? Over the neck, you are using the false ligament. What is that? Platysmal auricular ligament. So ligament is also a tough structure. So when you introduce your thread there, obviously the entry point holds everything towards them, right? And there you get the maximum fibrosis, because with the one entry point you enter many threads. Why you enter many threads? Because we want the entry point to have the maximum fibrosis, so that it holds the tissue for a longer period of time. Huh? Yeah, so what is vector? Now the question comes, I was coming to that point. What is vector? Vector is, in her case, what will be vector? Vector is always perpendicular to the zone of action. What is zone of action? Zone of action is her nasolabial line. Whatever you are treating is zone of action. Okay? If we are treating the the jowl area, this is her zone of action. So zone of action, the area you want to treat, the wrinkles, where the wrinkle or sagging is, the vectors will always be perpendicular to that. So for nasolabial line, vectors will be perpendicular to that. For jowl, the vectors will be perpendicular like this. For neck, it will be like this. Okay? So these are called as vectors. And vectors, there is an entry point and there is an exit point. Entry point always keep 1 or 2 entry point because we introduce maximum number from that point to give it a maximum strength, force of lifting. That is called as force of lifting. So we are actually creating a maximum vector force to create maximum fibrosis and to target more area. So one entry point and maximum. You won't be able to see from there. Huh? You can't see? Go at the front, no? Okay. So I can exit at multiple points. Why? Because that will pull up the entire skin if we want to. That will pull up the entire skin if we want to. Got my point? Any questions? I have covered everything. Vectors, zone of action, what thread we are going to use, why dermal threads are called as floating, because there is no anchor point in for it. It is floating in the dermis and it is injected superficially. It is placed superficial in the dermis. You cannot place it subcutaneous because the main idea is to regenerate the collagen. So it will give you only textural improvement. Okay, so one correction more. Monofilament. So I'll tell you that cannot volumize the skin because that's floating type. It does not have propensity to lift and correct anything. But yes, if you are introducing like many threads like say 3 to 4 packets, like a mesh technique, then obviously it can give little bit of strength and little bit of lifting, but you cannot promise that to your patient. Okay? Because something which is hanging does not have the capacity to lift, right? You have left it hanging in the skin. So how will it lift? To create the volume, you just need to go little deep. But deep, okay, fine. So how do you get to know whether you are superficial, you are placing the threads wrong, or you are in the right plane, or you are in the deeper plane? So if you are superficial, there will be dimpling. As everybody said, you can see a tract creating like this kind of tract. That means you are superficial. No need to worry about it. Just pull back where you are seeing this thing and again reintroduce the little deeper than what you were doing, right? If you are deeper, how will you get to know? So while advancing your needle, we'll keep checking, we'll keep lifting the needle so that it will show you that you are in the right way. If you are able to lift, because the cellulose structure, subcutaneous tissue, so you are lifting, that means you are in right way. That's a good marker for you. Another marker is if the patient is not wincing, you are in right plane because there is no nerve innervation in subcutaneous tissue. That's why I told you there is no damages, no vessels, no nerve. So what are you going to damage? Nothing. So why are you fearing about? Just start it right away. Nothing to, get skeptical and this and that. And until you do it, I will not know it. And these this mint people are so good. They will come and they will assist you, like how I'm going to do today for you. They are the people who are well aware. Those are the people I started 10 years back. 10 साल हो गया आदित्य हमें. 17 में publication थी. 4-5 साल पहले से और कर रही हूँ मैं thread. So maybe since 2010 or 11, I know him and I have it. And they were the people that time. There was nothing asymmetry. See, my face is asymmetric. Right now, you must not be noticing it. Now I'll let you know. Aditya, अब मैं तेरी बुराई कर रही हूँ. This is sad, right? This is left head. Can you see that? This happened with the doctor. 3 years? 7-8 साल हो गए मैंने थ्रेड का करवाया मैंने अभी. I have not done it. 7-8 years. कब आया था तेरा Korean doctor? So I was being very clever that Korean doctors are doing so many threads. Probably he'll do the best job. This is what he has given me. Asymmetric face. Okay. I need to correct it. Aditya has to correct करेगा. These are the threads. Cog करा था. That time it was getting launched. So I was invited into a hotel. ली मेरिडियन में था कहाँ था? So I was like, चल Korean doctor है, Indian doctor तो किसी को आता नहीं. That time only me and Gulima was doing threads. Not many of the doctors were. Indu was doing, not even Gulima. Dr. Indu Balani was doing. कौन जाएगा वहाँ पे कॉन्फ्रेंस पे मैं लेट गई. This is what he has.
So today what we are going to do is mono thread.
No, you people will be doing mono threads. I'll demonstrate you curve threads as well. Okay.
And what is the example?
If you have any of you have done it earlier, I'll let you get the feel of that how it feels. Okay.
And you were
Because
saying that anchoring, what are the examples of those threads?
curve threads.
Cock threads.
We anchor curve threads. The dermal threads,
That's the
mono
basic
threads,
threads.
double screw. Yeah. Those are floating type.
So all
That-
those double needle and all are anchoring.
anchoring type that are anchoring type. We anchor it on something like ligament or fascias and we tie it together to give more fibrosis and more tightening, more lifting effect.
They're deeper. Cock threads are deeper.
No. Plain is same.
Plain is same.
But
That is what I'm telling you. If you are deep,
they're long.
yeah, deep, but in the deeper subcutaneous tissue, not into the muscle. So the first indication will be if you are into the muscle, you won't be able to lift the needle while advancing. The second will be your patient. The patient will start wincing, ouch. For thread, there is no ouch. When you are entering, it's very comfortable. There will be just a traction force. You will feel that something is cracking through and you are passing through that tissue. Okay, but there will be no pain. If there is a pain, that means you are into muscle. Again, don't panic. Just pull back. Again, advance. Little superficial than that. You can just put your finger behind over the needle and the thread, so that the thread should not slip through. Okay. And then pull back and again little superficial to that. So there are two markers if you are going deep. One is that you won't be able to lift your needle, and the second will be the patient will start wincing. Patient will wince when you approach the end point, the zone of action. Why? Because there the nerve innervation is superficial. So that's the sign why you should not advance further. Now you should not cross the crease also. If you are not doing silhouette, you can cross with silhouette because the cones are made like that. Start. So I'll take the questions when I'll start doing it. Scalp पे लाया है. I'll demonstrate. वो तो मेरा बेबी है ना. I'm the one who taught
How they are
everyone.
different from the
Those are mono threads only, but smaller one because the scalp has a curvature, right? It's convex. A needle is straight, so you won't be able to manipulate. So that is why choose your needle and don't choose double screw because we don't need fibrosis here. We just need growth factors to be released, right?
Go a little behind, so that you also get space because she needs to do the injection.
Scarring alopecia, correct. It's intra. Mono threads are intra.
Because of him, you're not able to go back. No, just tell him to go over at least.
Start, ma'am. You ready?
You will be able to see.
Okay. I'm liking your spirit. What? No, 6 months. Easy rejuvenation because that gets diluted, hydrolyzed in 6 months. You have to anesthetize because we are going deeper. So whatever entry point is there, marker ले लो बेटा. आप लोग अपने कैमरा का लाइट ऑन कर सकते हो. मैम एक बार आपको बैठना पड़ेगा just to show them the markings. Now to the marking, never do it from the sideways, okay? Because that is the main reason behind giving asymmetry. Because face is already asymmetry. मैम थोड़ा सा face ना asymmetric होता है. एक तरफ ज़्यादा sagging होता है. जहाँ से आप सोते हो ना, that has more sagging. So you know dominant face theory. So dominant face theory is the side you sleep is more saggier than the because that is pressed for a longer period of time. So let me come to the center so that we can try to. You want to correct this one? We'll correct that. This one is more sagged. Okay. So she is smart client of ours. Okay. She knows what she wants. She knows what her deficiencies are, and you need to correct. So we have to make her happy, huh?
You will.
Yes, I will, ma'am. Don't worry, you are in safe hands. So this is your zygoma, and here your what is there? Zygomatic retaining ligament. So will come from this side. So from this will be our entry point. Okay.
from the bone on the bone. No.
over the bone, yeah. Or above the bone. So that. Now why I'm making this point, okay? So this is the line and we have 10 centimeter of the needle, okay? If I lift her face from here, she is getting 100% lifted. Can you see? Everybody come in the front, please. Otherwise, you'll miss something. This is very important part which I want to show you all. See, if I'll come from here and if I lift, it's 100% lifted. But then you will be able to introduce only 3 to 4 centimeter of your thread. So is it going to give any kind of lifting in later period of time? No. And it will become a floating type because there is no anchoring here. If I'm lifting her from here, are you getting any lift? Yes. No, you are not. Not much. Not much. Why? And here you'll be introducing most of the needle. So we have to choose a point. We can introduce the maximum length of the needle, the thread, all right, with maximum effect, and that will come around here. See, can you see that? From here, you're introducing almost like 6 to 7 centimeter of your thread, and you are getting a good effect. All right. So this becomes our entry point. Sorry, you can touch. I'll sterilize.
So any like a landmark do you take like from the angle of the eye?
Just you can introduce it here. You can introduce it here. You can introduce it here. Just avoid the vessel.
Lift and you see where you're getting the maximum.
Yes. Because this is going to our vector, so we'll pull from here. If our vector is this, we'll pull like this. Okay.
So in her case, do we need both the vectors or it will be just one in her case?
I'll show you both the vectors. Right now I was showing you why I'm choosing that point. Okay? That can be slightly up and down, doesn't matter, because the ligament is covering entire area of that. So anywhere you go, you will have a good anchoring. Okay.
And both the side it has to be same.
Zygomatic regardless. This is the zygomatic retaining ligament, right? So this is covering. So this is just over the zygoma. Palpate the zygoma, and just over that is entry point. सबसे लेट मैं ही चल रही हूँ ना. मुझे एक्सप्लेन करने की बहुत आदत है. मुझे लगता है बच्चे बस आज मुझे लगता है आज बच्चे जाएं और करने लगे.
वो सही में जरूरी है.
Because that is when we actually get the
हो जाएगा टेंशन मत लीजिए.
Right?
So entry point will be same on both the sides.
Yes, that will give you a symmetry of the face. Got my point? So this is our entry point. This is our entry point ahead of hairline, so that hair should not enter through the entry point and should not lead to granuloma formation or any kind of infection or any tract along the thread. So got my point? I can go from behind the hairline. If I have a scissor, I'll cut the hair from that area so that when I'm entering, there shouldn't be any hair. Alright? So now can I mark it? Okay, do it. Ma'am, मैं तो fat लग रही है. Just wait for 15 days and you are going to like this. Okay? So our point will be this. Okay. Now we are targeting the nasolabial line. So obviously, आदित्य, इस पैकेट में कितने हैं थ्रेड्स? 10 हैं.
कॉक थ्रेड.
हाँ. 4 हैं. तो 2 ही वेक्टर डालो ना ऊपर में या नीचे. नहीं ठीक है ना, तो इधर एक पैकेट ऊपर कर लेते हैं, एक नीचे कर लेते हैं. If required, we'll go for another package. Okay, so this is our vector.
she has a younger face.
The idea is, I'll tell you the reverse thread also.
There are screw threads and
Time and
the more
perfect, okay?
the cost of the thread.
We have to lift the marionette line. One more thread.
Yeah.
This is the safe
For that.
all threads are safe actually.
So see, is it symmetrical, ma'am?
No, same on.
Is it symmetrical?
Yes, because the other side we treat.
Is it? Is it?
Yes.
No, it's not.
This is
It's not. So you can anytime correct it, okay? This line is little lower than this line, okay? So I'll come and I'll correct it. that. This is my
It's actually vector
This is my
maximum
exit point.
That is
Okay.
why I
Is this symmetrical now?
Correct.
Correct. Now here we are targeting that platysmal auricular fascia, right? For the entry. So you can go just right from the entry from the earlobe, or you can just come from here,
Actually place
from
wherever we want.
ahead of the tragus. Okay.
When we are putting in the forehead, actually
Ma'am, please don't move and ask permission if we can move the face. You can come there and can see. I'll show you from this side also. I'll show you from this side also.
from here to here
Okay.
or here to here.
So I'll be coming from the tragus, and this will be the
That
or
is what I
the
was telling about the box now.
marionette line. Okay.
From the jaw, entry point that
That will correct the jawline as
so we
well.
go like this. So the so much like long. So we actually have a long nose. So here actually
And this is along the jawline.
because we
Okay.
want that upward pull to be there, and then we cut the thread.
3, 4, 5, as much lifting you want. There is no limitation to entry point, and don't enter 5. Cogs are very thick thread, okay? So don't introduce more than 3 threads from that area. Then you can make another point from here,
Put
and
it
then
upside down, and then we pull it and cut it.
you can do the cross hatching as well. So this is a straight vector technique, okay?
All the
This is a straight vector technique. If you want more threads to be introduced, you can do the cross hatching. Okay, so you can cross the line, and that will give more lifting and more
superior lateral direction.
just around the previous, anywhere. Okay, got it?
With the cogs.
Same. I'm talking about cogs.
Okay.
Yeah.
Cross hatching also with the cogs.
Yeah. Okay, with the cog. If you want to introduce more, if someone is 80s are coming, of course you cannot deny the treatment for them, right? There will be too much of laxity for everything, right? So cross hatching helps. That creates a mesh kind of thing, and that helps to reposition the tissue more efficiently. Aditya, anesthesia.
Are we doing the neck also for her? If not, can you show me the markings?
I'll show you the markings. If Aditya permits, then I'll do the head lift of this. I showed you a video, na? That day, neck lifting, you were there. You were not there.
The eye bags are there. We
Okay.
actually go in.
So now I'm anesthetizing. Now nobody touches the face, huh? Aditya, aaja.
That is what I was telling you. Because when we are putting it like that, we have this issue from this way. Whereas when we are
If patient is lying in 30 degree or 45 degree position, that's the best position for thread as compared to fillers, because in fillers, 90 upright position is 90 degree position. Here we are okay with if patient is in supine position, because we pull in the pressure. So now nobody touches. This is our entry points. These are, ये mixed है, ये plain है. So how do you anesthetize? First go deep. Ma'am, sorry, there will be one breath. Go deep. Give a bolus, then come to scan.
You have to follow the path of the needle. And over here, see, if it is monothread, if it's superficial,
You okay, ma'am?
but if you're doing a fog or if you're doing a fog, especially if you're So, but if it is, but this will be inside the skin now. It's not coming out. Cogs only it comes out. When it comes out, or in this at the entry point, the thread is moving, then you get it. So now
The other side, because how much time it takes for anesthesia to make it bloodless filled? Anyone? 7 minutes to be exact.
yeah,
Each time sterilize, make it a habit. Whenever you are doing injectables, obviously you are not sterilizing your wounding as you do for hair transplant, right? So each time you are injecting, always keep sterilizing the area. Any questions? Keep asking, because later on we may not get time because there is another session of thread. You can give as many cc. 30 ml in one session is okay. In hair transplant, you inject how much? 30 cc, right? That is how our kidney can filter. So 30 cc is enough. You have enough of adrenaline to inject, yeah, and anesthesia. Go ahead. I'm listening. I'm listening.
Around cross how many threads, ma'am? Around 20
We are doing cog ना कि double needle कर रहे हैं. Ma'am, I'm just cutting. वो है क्या तुम्हारे पास? एक दो वीडियो तो बना दो. Anyone? मुझे लगा मुझे क्यों तैयार करवा रहा है तू? मुझे सीजर देना थोड़ा सा काटना पड़ेगा. Ma'am, you can use this.
It depends on the patient requirement. So this will be for her. This is the better.
वो है micropore.
like for botox, we say start from close feet.
Micropore है. Ma'am, plate.
Thank you.
Volunteer.
You can see the makeup. And you should, as soon as you do it, show them the video. And whatever you see on the TV, because the process goes on, the new collagen goes on, so the data get that 90 days, huh? Tell them 90 days. So they'll see maximum result they will see in 90 days. And if they're not happy, it's for the damage here.
For the cheeks and this eyebrow, you do the same thing.
Same thread. The thread size is smaller when you are doing the. I'll show you marking for everything, but please remind me because I am very forgetful. So how much you are interested in learn? Just keep asking.
The size of the scalp.
Now what you do is, sorry, size of the scalp.
No. It's a 5 centimeter. Aditya, कितना है length? Eyebrows वाले का? 8 centimeters. And this is 10 to 12 centimeters.
The cheeks.
18 cos ये change कर दें.
Acne scars.
So this is 18 days needle. Why? Because the thread we are using has a cannula. For cannula, you need to make a entry point, right? So we are going to create a puncture.
Entry point, how long does it show from the skin?
2 to 3 days max.
Not 5 days. The scab will
Fall off.
That doesn't bother the patient because that comes right.
The hairline.
Yeah, the hairline.
That is being straight and
Trust me, even dimpling doesn't bother. Exaggerate things, but you have done the counseling and the patient, if the patient trusts you, they don't mind dimpling because the dimpling actually is a sign of good result because you have lifted the skin too much and the dimpling subsides in 10 to 15 days, and you just have to counsel the patient, just have patience. It will subside, but the result will be better because for dimpling reduction, you have to reduce, right? You have to pull down the skin, so that will not give you the lifting effect you are searching for. Okay.
So must not do
all these 3 arteries.
We don't do massage. I don't do it. See, it's been long. I have been doing it since 9-10 years. So I know every aspect of thread, what can go wrong, even if it's projecting, I've never seen granuloma formation happening, you know. It subsides in a month, right, Aditya? It gives a little, you know, acne kind of appearance to the skin. So try to reduce a little, but it doesn't get reduced, you know, because the symptoms actually appears after 1 month. It's not that common that immediately, because immediately if it shows, obviously you're going to reduce it. It happens because when you're introducing the exiting the skin, actually you have left it little superficial, so it keeps impinging over the skin. Okay, but that's also not a problem. That also subsides in a month. Okay. Needle thread निकाल लो आदित्य. So I think it completes 7 minutes. So we'll have. Okay. Now create little bit of track. Now I'm able to lift the skin, so I'm in the right plane. Okay. So I'll create little bit of track, both the side. Not required, but it just eases. You know, the rejuvenation with mono thread. That's for rejuvenation.
That is like cross hatching.
So,
Like what will be for acne scars?
even if it's bleeding, doesn't matter. Even if it's bleeding profusely, doesn't matter. Okay, it'll be okay. But if the patient is an anticoagulant, you don't need to stop the anticoagulant for the patient. That's the life-saving medicine, okay? We have a case report that a patient was undergoing filler treatment. The doctor stopped the anticoagulants for 2 days and the patient died of cardiac arrest. Okay? So you are not supposed to, this is a very minor procedure. It's just like any normal cut, okay, you are giving to your patient. Don't bother them, just counsel them. You may bruise and you may bruise a little. So that's okay and that's normal. Patients are comfortable and you just have to tell them the truth. But don't ever stop, you know. And if patient is on multiple anticoagulants, then you can stop the anticoagulant for 7 days, but don't stop the anticoagulants. Face down. So whenever you are introducing the face, the bevel should be facing down. This is the VCL thread. Always put your finger over the thread, because once if you are in the wrong plane, if you are pulling back, the thread will go inside. Okay, that is how the threads are incorporated into this needle. That once you enter, this gets deposited in the skin and you come out. So then you won't be able to pull out. So always keep your finger over the thread whenever you're going. Ma'am, can we start? You'll feel little traction. Don't worry. So this is a pinching technique. So that is how you know that you are in the subacute. Always keep your needle in the parallel, and I'm lifting it. What does it signify? That I'm in the right plane and you can see the patient is not wincing. That is also a sign that I'm in the right plane. Okay? So I'm trying to lift it the moment. She will start wincing the moment I'm near this area. Okay? So right now she's comfortable. Just
so we are maneuvering ligaments.
we are not maneuvering the ligaments. There is no ligament there. I have anchored here over the ligament. Now I'm going into subacute tissue. So that's why she's not wincing, because there is no nerve innervation. There is no blood vessels in the subacute. We all know, right? Now I have reached. I can feel. You can feel the needle here. No, you can feel. This is not a sterilized area. Yeah. You are in the right plane. Okay. Okay. Just 0.5 centimeter away from the line. Okay. Now give it one rotation that dislodges. Just one rotation. 2-3 rotation will trap to the thread. It's maybe same system है ना PDO जैसा. Yeah. So one rotation and then I'll come out. Again, I'm putting my, don't touch the needle, that will unsterile the area, right? So again, I'm sterilizing it. Can somebody show me light here? I can't see if the hair is going inside or what is happening. How the light should be so low.
He's doing.
God. Okay, now these are my vectors. I'm advancing, I'm lifting, I'm advancing. Always maneuver the skin over the needle, okay? Right hand will put pressure, the left skin will maneuver the skin, like how you do it over when you are sewing. I don't know how many of you sew these days, but yeah. She's damn good, she's not
Very
rinsing.
comfortable.
Yeah. So one twist and come out. Okay. Now comes the engaging of the thread. So lift the thread and engage the tissue. Massage the tissue up. Okay. इसमें बहुत ज़्यादा प्रेशर नहीं डाल सकते ना, फॉग बहुत प्रोमिनेंट नहीं है, निकल जाएगा. पुल करूँ? Okay, I'm trusting you. So this thread I'm using for the first time, but it's the same. How video threads are, just the material is different. I use PDO thread. They have just come up with this. Aditya has shifted to Mumbai, so now he doesn't care about the Delhi people. Now he cares only about the Mumbai people.
The tensile strength is
अभी वो भूल गया आदित्य.
what is
अभी आदित्य भूल गया है.
the difference between the cog and this, like the tensile
This
strength is
that's
different. This is
tensile
cog.
strength is good. It dissolves over a longer period of time. It stays for a longer period of time. 1.5 years, people say.
one.
Even the literature has
This
suggested.
one.
Molded thread, so it can hold 9 kg weight.
9 kg.
So can you see the left twist कर दें? अच्छा वो नहीं है. इसमें tie कर सकते हैं. Generally, what we do with the artery forceps, you twist it, and you twist it over here. The pressure you should feel here. Okay? Huh?
Interlocking is
ये ना, ये जो कर रहे हैं, ट्विस्टिंग नहीं. भाई तूने मुझे सिखाया है. ये तो तेरी सिखाई हुई एक्सपर्ट.
That will be the technical level. So that thing is like an there's a lot of sagging.
They have become such good experts. Oh, nice. Nice. So, do you see that? Okay. So that will give us anchoring over here and most of the fibrosis because you have interlocked threads over here.
Doing this intertwine inside.
Inside, yeah. Because he was pushing
How
it
many
down.
times you should do
He
it?
was creating pressure here. Okay, so I'll let you touch. Don't touch it here. Touch it here. Okay, you all. You can touch it, and you can see the pressure is here. When you pull it, can you see the pressure is here, not over here. Can you see the pressure? Not also we can put.
This is similar to mine.
Easy, you showed it. I'll just show you when I'll put the. Now I will always let the patient sit back because otherwise they will never differentiate how much lift and benefit they have achieved out of this treatment. So ma'am, you have to sit back again, sorry. Can you see the lift you have got? Don't get scared because the thread is still.
Don't worry.
Can you see your line? There is a dimpling. If you want, you can release it. But I would say never release it. This is a sign that she is going to get a very because fat is like a liquid. It's not a solid thing that you have repositioned and it is going to be there forever.
Release
Like
it with just little massage.
little massage you can do, but that will obviously relax the skin. So ma'am, do you want me to release or you can stay within your mask for 5 to 7 days? You can stay? Okay. So no need to
That will be better,
relax
na?
it.
It will be very.
I can do it after the procedure also. I can do it. And who is your doctor? Neetu. So she can also relax it. It can be relaxed even for the 15 days. Okay? After 15 days of the treatment. So never cut the thread before you do the both the side because sometimes asymmetry can be done because of the laxity in the skin and the kind of sagginess Yes, you have. No, because we have tied it. That the rotation is for that only. Huh?
Can you release somehow to know how to release?
Nice, clever question. I'll do that. After I do that. Anyone who wants to have hands-on, 1 or 2 people? 1? Nobody. ये क्यों दे रहा है? इधर anesthetize किया हुआ है. Just give me the needle. आ जाओ डॉक्टर. एक हेड सबको देते. एक ग्लास देते हैं. ग्लास निकालना मत क्योंकि बहुत ब्लड में कोई ऐसा जाएगा. See then people will think that I'm okay, fine. I'll let you do it. Ma'am,
Going to meet the director. So she was wearing like traditional dress in
again, see, I'm not able to lift it because I've gone to muscles just to show you. Then pull back a little. I can lift it. Okay. It's hurting, ma'am? Sorry.
rotate, then
Is it okay now?
need to rotate very need to rotate very
Just entry point. To create entry point. And compared to cockpit, these needles are little slimmer. So that's also the benefit. So you will pull it.
Now we have done this.
Don't touch the needle. Don't touch the needle. I was touching that. Put your finger on the head. It should not slip. Bevel down. Perfect. Go to the entry. Vertical. First vertical and then parallel to the skin. Come here. I'll help you. Yes. Go vertical. Good. And apply force. Little more force. Little more force. There is no harm. Got that traction kind of thing. You have to follow the line. So you cannot obstruct it. Yeah. Now slide the skin over here. No, don't pull back. Just go. Pressure. Sorry. Put little pressure. Is it hurting, ma'am? Sorry. If it's hurting, just come back. But little pressure. It's not that easy. Okay. If the patient has scarring from acne or something, then you may feel little resistance. Can you lift the skin? Yes, it's right. Ma'am, little bit of traction you will feel, not much.
Paining.
Little bit you will feel. Glide the skin.
These 4 faces, look at the 4 faces. All the 4 faces.
It's paining me.
So 4 curl technique, if you actually lift it here, yeah? See, if you can actually pull when you're pulling from
Okay, done, ma'am. Done. Almost done.
whereas when you pull from
Almost done.
whereas 4 curls, वो ज़्यादा दर्द नहीं करेंगे. The point to which directly, that is mostly what it is. 4 curl technique, when we pull it more posterior, release better. Don't pull back.
Just go. Okay, ma'am. I'll do. This is superficial. Can you see the dimpling? So pull back a little. That's why she was getting pain. Now, but done, ma'am. One rotation, come on.
Maybe you need one more.
Pull it. Sorry, I'll do it this side. It has already become sore, so I'll let you try from this side.
pull the skin as well. Here also gets that. There is when you actually pull it from here, so that is something no, it ended from here. Here it is directed towards here.
आदित्य थोड़ा ब्लड क्लीन करना, इसको गॉज देना रेशु को. So sometimes the second thread you'll find little difficulty, so pull the first thread and that will create the she has acne. So see, these are acne scarring, so that's why we were finding it difficult. Otherwise the technique was right, so don't worry. It is her skin which is making it little uncomfortable. Done, ma'am. Done. Okay. Glide your skin over the needle itself and make it easier and then come out. Okay. Done? Done, ma'am. You okay? So it's actually very complicated procedure. If the patient does not have any scarring or something, it's not that.
Needles cannula smoothly goes.
Yeah. So by massaging this, actually you are incorporating the fat, subcutaneous fat over the, you are massaging it, so it gets nice. Please show me through a little bit of light. I think the hair is going inside. Can anybody see any thread going inside? Any young doctors? No, no? No? Sure? Okay.
How long?
This dimpling, 7 to 10 days maximum.
So it will stay like this only?
No, everything will come down. I'll show you the picture. If you are comfortable, that's okay. If not, then I'll relax a little. Okay. So see, there are so many dimplings. Generally, this is not how you do when you are initially doing. Until unless your patient trusts you, they will not let you play with this much of, It's just that she's trusting me. I know what I can offer her the best. My patient knows me. That okay, fine. अगर मैम बोल रही है ना, there are some phase 3 clients also जिनका अगले दिन शूट होता है, then I relax it, but I put more threads so that it gives you a natural lifting to this thing. So in that case, they don't mind paying extra and using more threads. So you can do that. If you don't want to give any dimpling, you can introduce more threads, so more anchoring, more lifting of the tissue. So tissue will automatically lift from here, here, here. So you don't need to create any kind of dimpling or any such sort of thing. Aditya, Caesar. So the face is symmetric. I relaxed a little. आदित्य, ये स्लाइड बड़ा इजी कर रहा है. रिलैक्स हो गया, बस छूने से ही रिलैक्स हो गया. हाँ, तो फिर इतना लिफ्टिंग क्यों दे रहे हैं? फिर मैं रिलैक्स कर देती हूँ. So push back the thread and then and but I personally feel that it's a waste of threads here. You can insert the threads. Just check the thread is not palpable. Okay, you cannot touch it. Okay. So just push back the skin and cut it. And feel there is no thread palpable, means it has gone inside nicely. Okay, this has lifted very nicely. This is little less because she already knows that this was more saggier. So if I want to correct that, probably I can do more threads for her. So I'll do it later, but first let me correct her jawline. मसाज करूँ? हाँ वो तो मैं ओके मैम, यू कैन